Okay, so now I'm going to show you how to use gravity to help spin your baby into the best position possible for your labor and birth. If you're told or if you find that your baby might be sunny side up or posterior, then that means that their head is facing outwards. So their back is against your back. As you can see, this would be our pelvis with our pubic bone here in the front. This is our tailbone, our sacrum back here. If your baby is looking out into the world in this direction, then that's not a very good position for them to be born. The reason for that is that as they're coming through the birth canal, their hard head is going to be pressing against your sacrum, which is going to cause a lot of back pain. It can also make the labor a lot longer and possibly not happen at all until the baby actually spins. So what you want is your baby to enter into the pelvis either on your side, like that, or with their back facing out towards your belly and them facing towards your spine. If they're facing in this direction, then instead of that hard head pressing against your lower back, you're gonna have a squishy face, which feels a lot nicer and it fits better. So if you have been sitting most of your days reclined back like this, you've been making a hammock out of your back. And most everyone prefers to lay in a hammock like this. Very few people like to lay in a hammock like this. That's quite uncomfortable. So our idea is that we want to make a hammock out of our belly and not out of our back. So to do that, the best way you can do that is to spend 10 to 15 minutes each day doing a position similar to child's pose in yoga, or what we would call knee chest, which is where you're kneeling and you drop your chest down lower than your hips. As you can see, I'm using gravity to pull my baby out of the pelvis and spin it forward towards the bed or the ground, wherever you're laying. If we show you with the pelvis, it would look something like this, where your baby is posterior here, but as you tip your body forward, the head comes out of the pelvis due to gravity, and it's more likely for that baby to spin into that hammock position. When you come back up, they settle into a better position. So, once again, you're just going to allow your chest to fall forward and be lower than your hips so that you're using this angle for gravity to benefit you. And then when you come up nice and slow and kneel upright, because that's the time the baby's going to settle back into your pelvis.